Hello, everyone, and welcome back to another episode of A Small Town Farm Girl. This is your host, Kerrigan Johnson, and oh boy, do I have a treat for you. I have my fellow friend and a drug expert, Anna, here with me today to give you the juicy details about a special drug just for you. But first, a case study. 17-year-old male patient named Caden came into the dermatology clinic due to severe acne of the face and back. After meeting with the dermatologist, he was prescribed with isotretinoin. Now, Anna, what specifically is isotretinoin and what does it actually do?
I'm glad you asked. Isotretinoin is part of the retinoid class, and it is commonly used to reduce the amount of severe acne, and it will help prevent abnormal keratinization. It is also commonly used to prevent the worst of the worst when it comes to acne, which is known as nodular acne. Nodular acne is when there are many red, swollen, and tender lumps that form on the skin. If it goes untreated, it could lead to permanent scarring.
Wow, that sounds like something that my brother could use. But my next concern would be, is it incompatible with other drugs?
There are two drugs that it is incompatible with. The first one is tetracycline, which causes an increase in pseudotumor suppurae. Pseudotumor suppurae is a condition where there is an increase of pressure within one's brain, which could then cause headaches and vision problems. The second drug that it is incompatible with is any drugs that have anticholinergic properties. If a drug does have this property, it causes an increase of toxicity to it.
That sounds really interesting. Now, we all know that all drugs have side effects and adverse reactions. So what happens to be isotretinoins?
When it comes to the side effects of this drug, there are many different ones. Some of them are more serious than others. Some of the more serious side effects that come with the medication is that it causes one to have mental health issues, brain complications, bone and muscle problems, and it could cause a decrease in one's red and white blood cell counts. Then there are those that are not as serious, such as experiencing dry skin, chapped lips, or a dry nose that could lead to a nosebleed. More specifically, to mental health issues. There was a study done by Young Cheng Hung that compared to isotretinoin treatment to the risk of depression. The study found that isotretinoin isn't associated with the increased risk of depression, but it does help improve their depression.
That's really interesting to hear. So we all know that patient education is the most important thing to talk about when it comes to the patient. So Anna, what would you address to Caden when telling him about this medication?
First, I would tell them about the medication dosage and how it is specific to only them. Therefore, they should not offer or give it to anyone else. They would need to take this twice a day with meals unless told differently by their prescriber for 15 to 20 weeks. The special thing about this medication is that they are only given a 30-day supply.
Do you know of any safety concerns that the patient should know about?
Actually, there are many different safety concerns when it comes to taking this medication, but it varies depending on one's gender. If they were a female, they would be at a higher risk of safety concerns than males.
Bonus question, why is this medication a much larger risk to females?
Isotretinoin is a higher risk for females based off of fertility. With that, a female who is taking this, if they were to become pregnant, it could be fatal to the unborn fetus. The reason being is that it could cause birth defects, a loss of the baby before birth, such as a miscarriage, death of the baby, and premature births.
So now the question that we all dread. Are there any dietary restrictions?
I know it's the question that we all hate to ask, but it has been found on Practical Dermatology by Joshua Zigner, MD. For the optimal absorption of the medication, it is recommended that it is taken with a high-fat and high-calorie meal.
Well, that doesn't sound too horrible. Now, this sounds like this medication is more popular in the teen population. So do you have any tips on drug adherence?
When it comes to drug adherence, we are more focused on making sure that the patient is taking their medication. Especially for teens, they should be aware that not taking their medication is not going to benefit them, but harm them in the fact that their acne is not going to get better. To gain the best results of the medication, they should take it correctly and make sure they are taking the full dose.
Last but not least, is there anything we need to know pertaining to lab tests?
Oh yes, there are many things that relate back to lab tests. Like said before, there are some differences based on one's gender. For female patients, they are required to obtain 2 negative pregnancy tests before they are able to receive the initial prescription and a monthly before each new prescription. Then, for both genders, their labs needed to monitor the liver's function prior to therapy, about a month after, and then periodically thereafter. If there is a noticeable increase of therapy, the patient's healthcare professional should be notified, and then the prescription may need to be discontinued. Another lab that is done is to monitor one's blood lipids while the patient is under a fasting condition prior to the beginning of therapy, at the 1 to 2 week intervals until there is a lipid response to the medication, and then completed periodically thereafter. When overlooking the labs, one thing that should be noted and reported to the patient's provider is if their cholesterol levels start to increase. Then finally, some of the final things to look for is if there is an increase in one's blood glucose and platelet counts. There also may be a decrease in both the red blood cell and white blood cell parameters.
Anna, thank you so much for coming on and informing us about isotretinoin. Is there anything else that you want to let us know before signing off?
Don't isolate yourself because of bad acne. Take isotretinoin.